Hello, my name is Emil and I'm doing this video from a scientific article to obtain the DO diploma at the International Academy of Osteopathy. 2016, my promoter was Kathleen Brusling. I did an intertest reliability of mobility test of Atlas in rotation, and I used 56 patients with symptomatic neck pain. I used symptomatic neck pain because some authors suggest that it was better to use patient with pain in that specific area. That's before I started. That was my reasoning behind it. Yeah, we are two osteopath students of IAO from the 5th year and also authorized physiotherapists. Before we even started testing the patient, we did a pre-study up to where we needed agreement up to 80%. And here we did all kind of how we were sitting, where was our hands attached, what's how much we're rotating, how many times, all those kind of things. So we tried to minimize all the faults that we could do as good as we could. It took some time and it was actually pretty exhausting, but we managed to get over the 80% and we thought that was pretty good. So we went on from there, testing another day, but testing the 56 patients to see if we found the same rotation of Atlas. According to the International Federation of Musculoskeletal Federation for Musculoskeletal Medicine, we need a cutoff. They have a cutoff level at 0.6, according to firm. This is like a standard. If you cannot go above this, you cannot make a reliability intertest reliability above that. It will show that the test is not usable in this specific case. Unfortunately for us, we did not exceed that. We did not get above the 0.6. And this we can see here at the tables that we got a value, actually a good agreement with kappa, but it's only like 0.46. And even though we had, as you can see on the screen, there's a lot of agreement, but kappa also calculate for the coincidences that we would find the same rotation, even though that we did not actually were sure about it. So we could maybe do a confidence test where we like say how confident are you that we found this specific rotation, and that might have improved the kappa value. So like in this study, like in many other studies, the intertest reliability is not shown to be very good in mechanical testing. Some tests, some authors has seen that if they use a lot more tests on the same specific area, it will be easier to find. You will get the same results. So it's here we only use one test, which is not very reliable in this case, and it's not very like clinical. What you do in daily practice, because in daily practice as an osteopath you use vascular test, neurological test, anamnesis, safety test, observations, all kind of reasoning and counting the whole picture in. However, you should still be able to use the test probably, and they should be good enough. So because if you have like 20 tests, it will point in one direction, but if none of them are good enough, then you can discuss really if it's really worth testing all those kinds of things. It's a general problem with mechanical testing, and I found a lot of studies that found the same issues and even pure results that we did. Reasons for this could be, in our case, that we tested on one day, so we were pretty exhausted testing all those kind of patients, and it was and you will also adapt to each patient differently. And even though we like did the pre-study, there could be some small adjustments that were not correctly done correctly. So that could be thing. But however, we use those mechanical tests still in osteopathy. So for that to make sense, we use which is a structure either shortened or stretched, which could cause pain. For example, take a psoas muscle innervated primarily from the L1. So we say if it's a block there, it will cause a spasm, could cause a spasm in the muscle, and in a combination with the anterior rotated ilium, this muscle will be at stretch while still in spasm, and that is very logical to think that it would cause pain. But it does not, in evidence, does not show that the mechanical aspect of the body is known to cause pain. The biomechanical model is like out of date, or has not been proven right. So instead, we use the biopsychosocial model, or we should use that. We explained that in neurology a bit, but not in the deaf. And if we still uses the structure shorten or stretch, is that even good enough when we know that the biopsychosocial model is the best model we have for pain? This model is like taking into account that people are stressed, and people have catastrophic thinking and depression, lack of sleep, all those kind of things that can influence pain. So it's the brain that produces the pain the 100% of the times. But as an osteopath, we still uses a very simple model in some cases to explain the pain to the patient. And maybe we should consider doing it another way around, because it are we causing is it even, are we causing the patient is it nocebo effect, because we say that they have this and this and this problem, and we know that nocebo could be very just as good as placebo is. It could be this is a severe to get the patient nocebo. I know that a lot of osteopaths uses like the broader picture, and also we are using that serial rule. We are using the whole body, the hormonal system, all those kind of things. But our talk about pain and a structure either at short or stretch, we might have to reconsider that thought, because a structure at stretched and even a stretched structure at spasm is not necessarily causing pain. However, we have to take all things into account, and those kind of things. And then we come back to the same issue, that if we cannot find the same results in our testing, then we cannot even be sure that we are explaining that one structure is stretched or spasm, because if we cannot do inter-tester reliability, which is good enough, it doesn't even make sense to do it. But again, we are only fifth year students, and maybe if you're more experienced and all those kind of thing, even though some studies suggest that it doesn't matter, it might have an effect. And is it even important that we find the same things, considering all those that the body is such a complex structure with the biochemical system, which hormonal system, the neurovegetative system, and all the interpretation about the brain that we does not know a lot about. So yeah, this is another angle on the intertest reliability, but it doesn't mean that it's not important that we can find the same things, and the tests are not important. But it means that I think we should be careful about talking about structures in problems all the time, when we cannot be 100% sure, because we know from our clinic that the picture is a little more shady. It's shadier than we do in theory, of course. But yeah. So that was my little presentation video. Hope you liked it, and hope that it was not just a repetition of what I have written. But yeah. So bye bye from Denmark.